Hi everybody, Dr. Shawna Ruple here, the girl next door OBGYN. I wanted to answer a question I had gotten from one of my subscribers about what the purpose of AMH is, or how do I get a blood test for fertility. So I often will have patients or friends contact me and say, do I need a blood test? Am I getting too old? Do I need to do something? AMH is a really helpful test. I think you can get it really at any time. Some people will wait and get it when they're in an infertility process, while others will get it when they want to have kind of an idea of where their ovarian reserve stands. AMH stands for antimullerian hormone, and it is a hormone that's secreted by the ovary. The reason it's very helpful is because the level that is released by the body really coincides directly with how many different follicles are released from the ovary each month. So, kind of to back up, women are born with all of the eggs that they're going to have in their lifetime. They don't ever make more. So we're born with all these little tiny follicles within our ovary at birth. As we go through to puberty, that's when you start to have this access that's more predictable each month, and where you're going to ovulate each month. So there's a signal that's sent from your brain that creates your follicles, kind of develops them, and then the largest follicle is going to be able to take over. And that's the one that's going to be released each month. So only one is able to ovulate. Only one egg ovulates each month, but often there are multiple that kind of get recruited to see which one kind of ends up to be the big winner for that month. When we are closer to puberty, people may have 20 of these little follicles that will start to develop each month, and then one kind of wins. When we get closer to menopause, you may have months where none of them are actually recruited. You may have months where 2 to 3 are recruited. It can kind of vary. And so we can measure this mullerian hormone, or this AMH, to kind of see how many were being recruited each month. And that can give us an idea of kind of a fertility predictor of how fertile somebody might be. This could be helpful for, like I said, both people who are maybe on the fence trying to kind of weigh their options about when it might be a good time for them to start a family. And maybe they get this information back and they're like, oh, we have maybe less time than we thought. And so we're going to put that in our factor. This is a goal that we have in our lifetime, and we're going to use this information now to maybe make a decision to start a family a little bit sooner. And then you also can use it for patients who are going through infertility evaluation, and maybe we're looking at tubes and we're looking at a semen analysis, and we're kind of evaluating multiple things all at once. The AMH can be helpful for us to make sure kind of how much time we have, and where we are in that journey, if it might be a better idea for us to kind of move along and refer you to an assisted reproductive doctor, like a REI doctor that can help with fertility, if IVF might be a better option for you. There are ultrasounds that we can do that coincide with the AMH that give us more accurate information. And there's other lab work that we often will do when a patient initially comes to me and they have concerns about fertility. But I specifically sometimes get asked, like, can you draw the pregnancy hormone on me, or what's an AMH? So I just thought it would be interesting to kind of take a few minutes and chat. If you have questions, comment below, and I can always give more information. I can either type in respond, or I can post a follow-up video, but hopefully this gives a little bit of insight into what an AMH is, how we use it, and in which types of situations it can be helpful. So thanks for asking questions. Keep them coming, and I'll pop on and give more updates as I have time. Bye, everybody.